Well, good morning everybody. My name's John Williams. I'm from the Department of Law and Criminology at Aberystwyth University in Wales. I'm very sorry I can't be with you in person. I have been in Belfast since a week last Sunday at the invitation of ARC and Age Northern Ireland, and I've had a wonderful opportunity to see what is going on in Northern Ireland, meeting up with the Commissioner, meeting up with many older people, and also a very interesting session yesterday in Stormont with the ageing group. Today's conference is about human rights and health and social care, and the importance of building in human rights into any health and care system, social care system that we may wish to develop. Having said that, of course, health and social care are not the complete story when we're talking about the well-being of older people or indeed any other group of people. Well-being spans over health, social care certainly, but also over housing, environmental, educational, leisure, the whole range of activities provided by local councils. However, we'll concentrate this morning on health and social care. Human rights, they are very much in the forefront of the news. We've had the message from the Conservative Party when elected that they would seek to repeal the Human Rights Act. That appears to have been kicked into touch for the moment for political reasons. I suppose the one point to make is that even if the Act were repealed, and I sincerely hope it's not, I think it would be a dreadful message to send out. Even if the Act were repealed, human rights would still exist because they're so very basic and so very fundamental to the way in which we live our lives. But there is a lot of human rights law. Obviously we have the Human Rights Act of 1998, one of the major reforms introduced by the New Labour government. I'm not sure New Labour really totally appreciated the full impact of the Human Rights Act, but I think it's been a very welcome innovation and has certainly helped many vulnerable people and indeed many older people to enforce their rights. And that of course is based on the European Convention on Human Rights, which we signed and ratified in the early 1950s. Indeed, the UK was one of the principal nations involved in the drafting of the convention. But in addition to that, we have the Universal Declaration of Human Rights, which gives rights to everyone. It doesn't say just only to certain groups, it's to everyone, to all people. They have the rights under the convention, and that's a very important statement just after the Second World War on the importance of human rights to all nations and to all people. For older people specifically, we have the UN principles, and actually I'm a great fan of the principles. They are independence, participation, care, self-fulfillment and dignity, and nation signatories are encouraged to incorporate those principles into their own law, and it's encouraging to hear that the UN principles are part of the older commissioners' people's remit in both Wales and in Northern Ireland. And indeed in Wales we have incorporated those principles into our new social care legislation. We have the fairly recent Convention on the Rights of People with Disabilities, and again specifically for older people we have the Madrid Summit, although of course that does not have any real legal traction. Now, it is, I think, a fact that when we talk about human rights, we do talk about it in a very technical, legalistic way. We refer to Article 8, we refer to Article 3, we refer to vertical and horizontal effect. And to some extent, the human rights discourse has been hijacked, if that's the right word, by lawyers. I think it's also been hijacked by politicians, and we see certainly some politicians making quite a bit of mischief over the European Convention and the Human Rights Act. And also, I think it's true to say that human rights are a somewhat mystified thing. They appear something that is maybe a little bit removed from everyday life. In fact, they shouldn't be. They should be fundamental to our everyday existence. So, in a sense, what I want to address this morning is to try and demystify, to depoliticize, and if there is such a word, to delegalize human rights. Human rights do not belong to lawyers. Lawyers as people have human rights, of course, but it isn't a legal concept as such. And the clue there, of course, is in the word human. It belongs to us as citizens, as people of the world, whatever age, wherever we live, whatever our faith, whatever our sexuality, we have human rights. And they certainly belong to older people, although under existing international law and indeed domestic law, older people are rarely specifically mentioned. You might say that's a good thing, you might say that's a bad thing. I think that's open to discussion. We read a lot in the press, we read a lot about judgments of the European Court on Human Rights, and I would say that they are not always fairly reported. Clearly in some parts of the media there is an agenda which is certainly anti-European Convention, or maybe more widely anti-Europe. So I think sometimes it's difficult to fully appreciate what human rights do mean, and to get away from the rather distorted view that's often presented to us. But this rather technical debate, this debate based in law and by lawyers and by politicians, I suppose one could say really turns people off. It's a debate, it's a discourse from which citizens are very often just excluded. It's carried out at a certain level, and I think that puts people off. Well, that's bad, because if we're looking at developing, if we're looking at improving, if we're looking at changing the way in which we deliver health and social care for older people, a key factor is that we involve older people in the planning, both at the micro level and at the macro level, the planning of the whole service, but very importantly, the planning of the service as it relates to the individual, the need for the individual to be involved. So I think participation is a key element, and it's something that governments must recognise the importance of doing things with people rather than doing them to them. I think sometimes governments do actually get that wrong. So participation is important, and if participation is important, and if we say that human rights are important, and they are, then clearly we need to have a mechanism whereby older people and other people can participate in that debate without, if you like, being scared off by some of the technical way in which, I'm a lawyer myself, lawyers and others in the professional world, practitioners, conduct this debate. And the key there is, what do human rights mean to individuals? What do human rights mean to the resident of a care home? What do human rights mean to the patient in hospital, the older patient in hospital, where there may be a delay in them being discharged? They want to get home, but for various reasons their discharge is delayed, and then somebody calls them bed blockers, which I think is absolutely offensive. What do human rights mean to the individual who is receiving care in their own home? It may be around what time they get up. They're used to getting up at 7 in the morning, but the system is such that no one can arrive until gone 10 o'clock to get them out of bed. So where do human rights fit into all this? Where do the human rights fit into putting people in diapers rather than providing personal care to help them go to the toilet? What about the dignity issue? Very important. Dignity is important to us. we take it for granted until we lose it. And when we lose it, we really feel very, very vulnerable. So how do we, and how do you, enable people to be involved in the debate on the future of health and social care? And how do we enable people to say what human rights mean to them? Because as I say, at the moment we couch it in terms of the law, we couch it in terms of rights, legal terminology. Maybe we should discuss it the other way around. We should look at what it means to people, and then what people expect, what people reasonably expect for themselves and maybe for their parents, for their children, and then we can translate that into article whatever it is of the European Convention. So, health and social care. Perhaps two areas where human rights are critical. As I've said, if you are in hospital, you are immediately very vulnerable. If you're an older person in hospital, you may be extra vulnerable. Sadly, we see ageism in the health service and in social services. Sometimes people are unaware of it, sometimes it is the result of deliberate policies. And certainly in social care, the idea that at 60 you move from one category, which may be physical disability, into the older persons group seems quite frankly to be nonsensical. What changes on your 60th birthday? Actually not a lot. It's just a different number. So human rights are critical to health and social care. And it is essential that, and I know in Northern Ireland you're looking at reforming the law, both in terms of mental capacity, a very important area where proper safeguards are required, in terms of social care, and maybe in terms of adult safeguarding. So yes, a lot going on, and it's important that these new laws, these new policies, these new procedures are firmly rooted in human rights, and to do that we need an understanding of what older people understand by human rights. And we can't achieve this by discussing it at a very abstract, legalistic level. People need to tell lawmakers, policymakers, third sector organisations, people need to tell them in their own language what human rights actually mean. And it's very much about concentrating on the everyday needs, the everyday wishes and aspirations that people have. It's simple things. Yes, we can translate those eventually into particular rights under the Convention, particular rights under the UN principles, under the Universal Declaration of Human Rights. We can do that, but that's not the way people are going to tell us. And we have to listen to the way that people tell us what human rights mean to them, because they will tell it in a very personal and a very individual way, and we must listen. Now, in Wales, we recently published a declaration of rights of older people. And I certainly don't want to suggest that Wales in any way leads the field, but I think it was a very interesting exercise to do because what we did, we didn't start with conventions, we started with people. And we asked older people, what do human rights mean to you? Put it in an everyday language. Tell us in a sentence what you expect. Forget numbers of conventions, forget acts of parliament, forget the European Court on Human Rights for the moment. Tell us what human rights mean to you. And their comments were very interesting. They went, some examples. My pets are more important to me than people. I want to stay at home because I can keep my dog, my cat. The way I dress says who I am. I want to use my own language. The one I like in particular, don't make me sing Daisy, Daisy, I much prefer status quo. I want my care home to welcome my same-sex partner. Now all of those we can translate into numbered rights in the European Convention, but that's the way people wanted to tell us what the rights meant to them. I have a right to be valued. I still have places to go and people to see. I may be more restricted in my ability to travel, but I still want to go places. I still want to do things. Please talk to me, not at me or about me. That came through time and time again, that sometimes the typical setting, the patient is discussed over the hospital bed as if the patient had absolutely nothing to do with the discussion. And it's that wonderful title of the radio program, Does He Take Sure, that really does illustrate that kind of mentality. I need to be involved in decisions about my life and my community. I don't want special treatment, just to be treated with common courtesy and decency. These are what elder people told us. These are the words they used. And again, as I say, we can translate them into convention rights when we need to. I'll decide who I will have relationships with. I decide when I go to bed and when I get up. Sometimes I just need a little bit of help so I can get on with my life. Again, we can translate those into human rights. Don't wrap me in cotton wool. The fear that we devise a system that is too protective, that's too paternalistic, that doesn't recognize that people have the right to decide, and very importantly, the right to decide to do foolish things, or what others may think are foolish. I like being around young people. A nice one here, I think it illustrates perhaps how people think about older people. I was a bookkeeper. I asked the local charity if I could keep their books. They said it would be too much for me at my age. I told them to write down 20 random numbers. I added them up in my head faster than they did on the calculator. They took me on. And that's about being valued, being appreciated, and not being written off because there's a certain number attached to you. I don't want special protection, but I do want the same protection from the law as anyone else. And we know that rates of conviction, or certainly the ability to access justice in cases of elder abuse, are very, very limited. Very few cases end in prosecution. Not all cases should by any means, but I think it should be more than the exceedingly low figures we see at the moment. So these are the sorts of ways in which we should engage older people. Yes, as I say, we can do the bit of fitting them into numbered rights. But how do people, how do individuals, how do older people who are patients, who are in receipt of social care, how do they, what words do they use to express what they see are their basic rights? And we must listen to that, and I think that will be very helpful in devising new policies and procedures and law. So I hope that's delegalized, demystified, and maybe depoliticized human rights a little bit. Yes, we have the work at the other end of couching them in legal terms, but I think my message would be, let's not take our language to older people. It's language we use as a kind of shorthand, sometimes we use it lazily. Let's not take our language and expect people to fit into that. Let them say for themselves, let older people say what human rights mean to them in the health and social care context. Thank you very much for listening, and I wish you well for the rest of the conference, and my particular thanks to ARC and AGNI for the invitation. It's been a wonderful visit. Thank you.